retired United Methodist Church. I've got 50 years of stories because I pastored for 50 years. So how do you sort out some of those? You just tell your own. Well, I'm a worn out, healthy Methodist preacher. But in my worn out years, I am seeing a doctor a little more regularly. This is just to tell a story about what happens within the system. Now, I'm a part of a denomination that has a wonderful insurance program, Cadillac. I'm a retired person. My board of pensions pays my premium. I have nothing to complain about in those regards. I had a little sebaceous cyst show up on my shoulder. Discovered that those have to be cut out surgically. So I'm told you need to go find my family doctor says, we can't do that. You'll have to find a surgeon to do that. So you first meet a surgeon. I go, well, we're going to have to go to a hospital. This will be a hospital. I said, outpatient. Okay, yeah. But I go in the day before for that hospital to go through all the testing that you do, which, EKG, on and on and on. I had just had cataract surgery done within the last 2 months before that. Did those same tests for that. I understand those. I said, I just had those. I happen to know they're good for 3 months. Let's don't go through that expense again. And I was told, oh yes, we have to do it here in this hospital. I started putting my shirt back on. They said, where are you going? I'm going over to UMS and getting the test results. They're mine. I paid for them. Well, wait a minute. They go, undergo in a few minutes, come back. No, we can't get them. Put my shirt back on. Where are you going? I want to get them myself. I said, I'm on my insurance committee of the board. I know a little bit about this. I know, well, they were telling me, oh, you've got insurance, you've got, what's the thing called Medicare. Well, you care. They come back the third time with the documents. They had emailed them over. I had paid $432, or my insurance had, 3 weeks earlier, and I was about to pay that again, just because it hadn't been an argument. That just happens with that. It's double testing, they call it. Obama mentioned that last night, if you listen to him, and so it's a pretty common practice, I guess. What's the problem? You got insurance. I had that surgery done 15 minutes. Local option. Local anesthetic. I get the bill from the hospital, $4,300. Now that's just the hospital's bill. It's not the surgeon's bill. I had to wait 5 hours to get in because the surgeon was busy. The hospital administrator I knew relatively well, and I called him up. I said, I don't want to complain. I just want to state a case. I've been a pastor 50 years. When something's going wrong, I think you ought to know about it. I said, was I charged by the hour when I was in that waiting room? Well, no. You see, that was local option, local anesthetic. But we had 5 nurses in that room while they were doing that for 15 minutes in case something went wrong. Now that again is a problem with the system where our society is so lawsuit happy that if something goes wrong, these people have to pay through the teeth for this, so therefore they got all that precautionary stuff. We got a lot of healing to do, folks, a lot of healing.